the median age for mantle cell lymphoma is 65. So you would imagine that, quite a majority, most of the patient would be, fitting into that category of more elderly and may have medical conditions where moderate intensity or even options that are free of conventional chemotherapy would be very, very welcoming. So indeed, they are phase 2 clinical trials that looking at chemotherapy-free combination. We initiated the very first such combination, which is the combination of lenalidomide plus rituximab. That was over 10 years ago. And I'm happy to report that even to date, we have, maybe 60% of our patients continue to be in remission, and they haven't really seen any component of conventional chemotherapy. So the progression-free survival after 5 years is still around 60%. And there are other combinations incorporating BTK inhibitor now in the chemo-free strategy. 2 examples of such are the combination of Ibrutinib plus Rituximab. This was studied by both the MD Anderson elderly study, which included 50 participants, as well as the European Giltamo Ibrutinib plus Rituximab, also with 50 participants. And, the survival data has been really excellent. I think the 3-year progression-free survival from those 2 studies are approaching about 90%. And certainly we look forward to more longer-term outcomes. And it is in a selected patient population. However, it provides a very strong efficacy signal. I also want to point out that the European Ibrutinib plus Rituximab trial also included an option for patients to stop treatment after 2 years if they can achieve MRD negative complete remission, which is very high quality remission. So that's very exciting. It is presented with a strategy that is free of chemotherapy, but with more finite treatment duration. So I think those are really very exciting options in the frontline setting. And I think importantly, along the same line of discussion, there are 2 randomized phase 3 study that comparing the chemo-free option, BTK inhibitor plus Rituximab, one with Ibrutinib, the other with Zanubrutinib, together to compare to chemotherapy. So that's the Beijing study, which is phase 3, and the other is the Ibrutinib plus a Rituximab in the ENRICH phase 3 randomized study. So I think those would provide very, very important informations to compare directly the effectiveness and safety with chemo-free combination versus conventional chemoimmunotherapy.